Welcome everybody to our continuing series as part of the MPA program at the University of San Francisco School of Management. Today we'll be talking to my colleague Rich Callahan, who's worked in the health services concentration for quite a while and has been in the space for 20 years working with private, public, and nonprofit entities in healthcare. Rich has a wealth of experience from a general management perspective and specifically in the application of those skills in the healthcare space in particular. Rich has worked on an impressive study that's looked at distribution of funds related to the CARES Act, which is instructive retrospectively to understand how that program worked, and also prospectively to understand what takeaways and learnings we can have to apply to future programs that are similar, which is a really fruitful area of research because from what we can tell, this will happen again in some form or fashion. So Rich, maybe you can give just a brief description of the study, what its goals were, and what some of the key observations happen to be.
Very glad to do that. The CARES Act was studied out of the National Academy of Public Administration. I'm an elected fellow there. It was funded through the National Association of Counties. There were a 3-member expert panel, myself, Chris Mim, who heads up the Government Finance Officers Association. So you'll see a theme here, follow the money, show me the money, to quote the Jerry Maguire movie. And Lisa Gordon was the 3rd member. She's a very experienced public manager in county and city government and is currently the executive director of Habitat for Humanity in Atlanta, Georgia. We worked with the full-time staff at NAPA, led by Sally Yeager, who had over 20 years of experience at the U.S. General Accountability Office. And in a 3-month time period, they working together, pulled together a really comprehensive study of over $150 billion of funding to counties. Wow. That to the largest counties over 500,000 people throughout the country, and that's a total of 119 counties. And then they did 6 case studies of it and came up with a great set of recommendations. Valuable, as you said, Vipul, not only looking backwards, but the people I talk to in public health, pandemic seems to be coming more frequently and with greater severity. So you have Ebola outbreak, Zika, now you have worldwide COVID. This part of the landscape there may be the more frequent. And so looking forward from what we've learned from this experience is enormously important. Otherwise we're like Bill Murray in the movie Groundhog Day, different day, same script. So this reports how we learn from today, lessons that are real important for tomorrow.
What things did you find that were surprising that you didn't expect to see before you got the study rolling?
The most surprising piece was how central the U.S. Department of Treasury was to disbursement of this funding. You would expect it might go to federal agencies that more traditionally work with state and local government. Treasury does for debt financing, for bond servicing. They had an office. The other piece that wasn't surprising, but is shocking, is that office under the previous presidential administration wasn't staffed up. And that meant there wasn't expertise there and there weren't people there to help provide the guidance needed at the front end of disbursement of this funding. That's since been corrected. Under the new administration, there's much more staffing there, and that office has been built out for the next round of fundings.
Just curious on that front, mechanically, was it the municipalities, just local governments in general, did they have an account at the Treasury, or did they use the Fed as a bank in that regard? How did that work mechanically?
And this was something Treasury was excellent at, which was disbursing the funding very quickly. There was a requirement from Congress that the money not only had to be obligated, but had to be incurred, the actual expense, by December 31st of 2020. The report gives credit based on the interviews of people from county government on how well and how quickly Treasury was able to disperse needed funding. So that was a strength that they had.
Well, Interesting. There's been criticism that the funding from the CARES Act and then subsequent funding that's been more recently passed may have been used to shore up governments that had sort of budgetary failings or budgetary lack of discipline, and this was sort of a plug, COVID aside, to bolster their balance sheets when sort of an undeserved windfall. How would you characterize that statement in terms of its veracity?
Well, one, you're not punishing the officials from the government by withholding funding. You're harming the citizens who live in that jurisdiction. They're the ones who are served by this funding. So, two, it's unprecedented times. People are facing literally a pandemic. And so to withhold funding from a jurisdiction that may have had budget problems in the past really ignores the responsibility of the federal government and state government and county governments to the citizens who live in those jurisdictions. So if there were problems in the past, work on those problems. But my view is the funding got out to need it, the counties need it, and those counties provide direct services to citizens. This isn't an abstract set of services. This isn't some sort of political theory debate. There's people who are hungry. There are people who are losing jobs. There's people who need public health services. There's other ranges of service, including law enforcement, that need support. Get the federal money to those agencies. And let's look at this on the private sector side. Does anybody ever say, let's withhold a tax benefit to a private sector company that's been poorly managed in the past? Oh, let's not do a government bailout to a company that hasn't done well. No. Let's apply the same logic to serving citizens in those counties.
So there's almost a local government is too important to fail, if not too big to fail. Well, in that regard.
Well, yeah. I mean, people would say, "Oh, banks are too big to fail." Yeah, the bank's responsibility is to shareholders, right? The federal government stepped in and supported those banks, supported through toxic assets relief fund programs, supported failing companies. When you're talking about local government, you're not talking about a government unit. You're talking about the people that live in that jurisdiction. You're going to withhold fundings for them because there were the accounting processes may not have been in place that should have been in place on other issues in the middle of a pandemic. No, I don't buy in that line of thinking at all.
And in terms of the use of the money, what did you find was typically the most pressing needs the counties had, or at any level of government, really?
There were a range of needs. It could be from PPE, personal protective equipment, to supporting law enforcement. There was one of the strengths of the CARES Act funding was it allowed the local jurisdictions to determine what were their needs. The case studies of 6 different counties, including a large county such as Cook County, counties from across the country, looked at 6 of them. What they were looking at was really how to get at health equity questions, how to improve health equity in terms of access and outcomes, and funding could be used for that. So it really is. I mean, it reflected one of the great strengths of federalism, and not to go into a great deal of political theory, but problem solving at the local level has always been one of the great strengths of the federal system, and this provided funding for that. So I would say, in response to your question, there's a range, and the range was determined, as it should be, by the locally elected officials who are stewards of and responsible to the people who live in their jurisdiction.
So, in speaking of the federal approach or federal system that we have, do you feel, or did you discover through the study that any means testing would have been useful? And I know there's a need for speed in the sense of getting this money out, and so you can't really do a lot of that algorithmic thinking. And looking back at 9/11 as an example, when I think the stories were governments in the Midwest got fire trucks for things that happened in New York. And so was there any patchiness in terms of certain areas were hard hit with COVID and didn't get as much as other areas that were more lightly impacted? I say that knowing that in the end, everyone was impacted. Every nook and cranny of the country had some, a significant COVID-related hit. But is means testing, was that useful? Would it have been valuable, or would it have just taken time and not really delivered much different in terms of outcomes?
So this is happening in real time, and tax revenues are coming in real time. And so the means testing question, would you test on anticipated funding? Would you test on the funding that came in last year? What the shortfall is this month? Taxes in counties, I know from my work in LA County, are coming in on a quarterly basis. So it's not realistic in the midst of a pandemic where people are dying to require that sort of means test to say, do you really have the revenue shortfall that you anticipate? That's not something that can be easily answered in real time because of the way cash flow works in county government. So the other piece is that really think of means testing in terms of individuals. If you have individuals in your county that aren't getting health care that they need, that can't get the transportation, that are losing jobs, and you need funding to support them, each county faced equity and health access challenges, and putting funding into that shouldn't be tied up with a larger question of as a population as a whole and as a jurisdiction as a whole, should there be means testing? So providing funding in real time for real people, that's what seems to be one of the important lessons of the CARES Act was.
Makes sense. And in terms of, as we prepare the healthcare leaders of tomorrow, from a budgeting process and leadership through budgeting, which in a way is the most authentic form of management because you're allocating scarce resources. What learnings or takeaways would the leaders that we're grooming as part of our MPA and HSA programs really learn from the experience that you had in the study in terms of forecasting, reserve fund allocation, things of that nature, prioritization?
Well, the number one lesson that was that professional preparedness matters. The skill sets that you develop matter. And that was the NAPA report states it nicely about the insufficiency of expertise and staffing in the Treasury Department to get this started. Again, Treasury did well at dispersing the funds, for providing the guidance and helping and partnering with local governments, with NACO and the other associations at the front end for counties, for tribal, for state governments. That takes a level of expertise. That expertise is developed, whether it's in graduate programs, whether it's through professional experience. Expertise matters. And in health, it matters in terms of saving lives. And the ability to do that, outside of this study, I had the good fortune to be able to interview Mark Lorette, the CEO and president of UCSF Health System, a $5 billion health system. And
Right.
Here's an example of where professionalism makes a difference. They were able to assess their needs at the UCSF Health System. They had tremendous set of doctors and nurses who volunteered to go to parts of the country last April and May, specifically the city of New York and to the Navajo Nation, and bring their healthcare experience there. That's possible because you have strong health administration. You have a core value. You have health administrators driven by core values. You have healthcare professionals, doctors, nurses, physician assistants, the range of healthcare providers who are driven by core values. And really what professionalism means is you can assess the need and you can work together to address the need. UCSF and Mark Lorett's discussion of that is a good example of this. In terms of your specific question on budgeting, I would break that into a larger question. The pandemic shows that emergencies aren't limited to places that experience hurricanes or floods, or when you have urban fires or nearby wildlife fires that affect lives and properties and the air quality. The healthcare, the public health, the pandemic threat is a reality. And so two dynamics. One, the dynamics of budgeting in advance and being able to figure out and what sort of resources are needed. I mean, the number one lesson from this in terms of budgeting has been the 20-year or longer chronic underinvestment in public health. And so from a budget standpoint, being able to advocate for what's specifically needed and how to really do that, because an investment in public health is an investment in literally our societal health. It's not an investment in some abstract. It's not just limited to it. It helps those who are in the greatest need, and it helps us as a society. So that's the first piece. On the emergency piece, the story is always told at any training session on emergency management is if you're exchanging business cards at the incident command center during an emergency, you haven't prepared. And so I think one of the real lessons to learn is not just in terms of content knowledge, but preparing your professional network so that you have people that you know that you can rely on, and you're building that in advance of when you need it. Whether you're a student or if you're managing a healthcare organization, you have that network in place and you can draw on it quickly, reliably to respond not only to the budgetary aspects, but really be effective at responding to the human aspects.
Makes sense. In terms of where the underinvestment was acute, where were those specific areas from which you observed?
Losses of positions in public health, the actual people who do the work, their staffings were cut in county and public health departments across the country. There's an article by a really good investigative journalist out of the LA Times who basically made the case that the funding that supported Homeland Security, as important as it was essentially shifted from public health. Well, if we need to fund Homeland Security, fund it, and fund public health. Don't take the money away from it. And it shows up in everyday instances, whether it's increases in sexually transmitted diseases. It shows up in the ability to prevent. I mean, on a good day in public health, nothing happens. And nothing happens for a reason, because you've been able to do the front end work on whether it's disease prevention, whether it's contact tracing, whether it's surveillance. Here's an investment that would have made a lot of sense for the United States. Keep the office open in China that was there for the CDC for disease surveillance. That's an investment. That's not an expenditure. So time and time again, there are these investments that they don't benefit some abstract government department or some bureaucracy or I mean, Ronald Reagan got it wrong. He said, well, government isn't the solution, government's the problem. Well, he never faced a pandemic. He never faced a situation where people are dying because of underinvestment in public sector agencies. What we learned in the pandemic is government agencies in partnership with nonprofits, community-based organizations, with the private sector, that ability to do partnerships creates solutions, and addresses real acute societal problems.
On that point, and Reagan's quote, what were you heartened by in terms of what you saw? Because I think people sometimes forget that government is simply an expression of ourselves, at least in this country. And
in the case studies, it showed innovations. It showed the ability to adapt. I'll quote my former judo coach who learned this in the Marine Corps. You got to adapt, improvise, and overcome. And so you saw an adaptive mindset. I think what we really saw was the public service ethic. You would see it in Dr. Fauci. You would see it in other professionals who would argue, even at the cost of their jobs. The chief epidemiologist in Florida was fired because the state didn't want to keep data tracking the way that had been done by the professionals. So people stood up who were professionals in public health, and they stood up for the community as a whole. I think the other piece to point out is the recognition that our healthcare system doesn't adequately take care of those who are most vulnerable, economically vulnerable, vulnerable in the communities that they live in, and that we need to invest in improved health access, improved health equity, and improved health outcomes. And it's not limited to just one part of the country. I mean, tragically during this, though not specifically because of the pandemic, though related to it, for the first time in the United States 2 or 3 years ago, you see life expectancy decline.
Mm-hmm.
Part of it's due to the opioid epidemic, but overall it's due to, I would say, two things: the literal underinvestment in public health and the mindset, again, the idea that government isn't the solution, it's the problem. It's not the problem when someone's getting healthcare through Medicaid. It's not the problem when they're getting healthcare through Medicare. It's not the problem when people are getting their Social Security checks on time. No, we have a long track record where government is the solution. The pandemic points out the need for it, and particularly the intergovernmental dimensions that we don't, our most challenging problems in society are problems that we solve through the intergovernmental system, whether it's clean air, whether it's public transit, whether it's clean water. We have a history, particularly over the last 42 years, dating back to the Clean Air and Clean Water Acts of 1968, that when we work together through different levels of government, each with their expertise and funding, and work with the people closest to the problem, we can solve societal problems. We can make progress on that. And this really brings home the pandemic brings home the importance of investment in and reimagining the intergovernmental system. And particularly, I think the professionals in healthcare, because of their longstanding work with the federal agency, the Center for Medicare and Medicaid, CMAS, working with them. Healthcare is particularly good at, and foundations in California that work on health recognize the intergovernmental dimensions of getting the cooperation from state government to work on local issues, working with local government, city, county, and state together. And so that's a dynamic that's not talked about much, but that's an important dynamic that emerges from this. And it allows us to address the health equity, health access, and improved health outcomes that we need to get at.
That's great. I think this has been really interesting in terms of understanding, and the study itself just having been done, I think creates two things. One is an opportunity to learn some form of light accountability at least, and then also a potential blueprint for what worked and what didn't going forward. And one of the things—
I just want to jump in on that, because actually under the current administration, it's been recognized and the investment has been made in the Department of Treasury's unit that deals with local government and intergovernmental relations, not just on the bond financing side, but also because of the funding that the additional funding Congress is provided. So I think this gets at your earlier question about what does it mean to be studying for a degree. It means you can take lessons from the past and apply them. You're not trapped in the same script. You can write a new script for the future. And that's what, I mean, we've seen our students do it. I mean, we had 2 MPA graduates starting in March of last year. One was out of the Office of Homelessness and handled the emergency response at the Moscone Center. And another student was out of the Office of Emergency Response and directed the overall effort. And these are 2 recent graduates from our MPA program who are literally writing a new way and a better way of moving forward in the middle of a pandemic. And so in other ways, we've seen students do that too, whether for, as part of the UCSF system, we've had graduates working there. We have a student working in the Governor's Office of Emergency Management in Sacramento. So we really take seriously that this is a program that prepares you for societal challenges. God willing.
I've been impressed by, just to your point, the grads from the program finding themselves at all levels of government and all levels of the system, or all aspects of the system, from city, county, state, as you're pointing out, to private sector, and academia, UCSF. They have had to step up because they've been in the positions to, make a difference. And I think that's been really inspiring, actually, to see. And it's folks who've taken on responsibility immediately.
Yeah, it's one of the values that drive the people in our program is the core value of contribution. They want to make a difference with the work that they do. And that's been so visible. Without mentioning names, you or I could sit here and talk about 4 or 5 students, high visibility positions. And never mind the mayor of San Francisco, who's leading the way nationally to say, we can't we have to do something at the front end of this. She's a graduate of our MPA program. So,
and San Francisco has had one of the lowest rates of infection of any major city, despite being the second densest city in the country, which is, you know, an impressive accomplishment.
It speaks to, again, professionalism, listening to professionalism. As a colleague of mine who worked in LA County used to say, the director there would say, show me the science. Well, it doesn't do any good if you show the science and no one's going to listen to it. And I think to the credit of decision makers in the Bay Area, some of whom are graduates, they not only showed what the science was, but then they acted on it. And this pandemic has shown that that doesn't always go hand in hand. And I give enormous credit to our graduates and to any professionals out there who are able to really help decision makers, elected decision makers, see the science, make decisions based on the science that then support the entire population health.
Yeah, and I think on that point, they were in tough positions to make really tough decisions, but stuck with using their values to guide to be a compass to guide their ultimate direction, which is also, you know, sometimes, again, the calls were tough.
Yeah,
and weren't popular either.
Yeah, core value driven leadership's not easy leadership. And so I think you understated to say they're tough calls. And there's lessons to be learned from the examples of people who made difficult but the right calls at the right time and made a huge impact on people's lives.
Agreed. Well, Rich, thanks for taking the time today. This has been great. I think that the big takeaway is that despite a lot of criticism, all levels of government, as you kind of referred to it, intergovernment cooperation, really was able to act quickly, plug some critical holes, and make an impact in a critical time. So I think this report really provides that the visibility into that. We'll link to the report and the press release as well that summarizes some of the report's findings. And again, thank you for taking the time today.
Thank you for the work that you do with our students, the professionals that you bring into the program, the teaching that you do, and the perspective. I greatly appreciate how your perspective from private sector innovation, from the private sector, and from health systems. And so it points to one of the great lessons. When you're faced with big challenges, you need a team with a lot of different skills. And so I admire what you do for our students, and I'm glad to support those efforts.
Appreciate it. Thanks, everybody.